Hello and welcome to Engaging Midland. I'm your host, Randy Fee. I'm also the town's of Midland's Communications and Marketing Coordinator. Thanks for joining us today. We have a great show put together with two pretty relevant issues in a lot of people's minds, especially in Midland, COVID-19 in North Simcoe, and the King Street Rejuvenation Project. Before we get into those topics, though, I'd like to introduce our guests. First, we have Gail Hunt, President and CEO of Georgian Bay General Hospital. Nice to see you, Gail. Hope you're doing well. Thanks for joining us.
I am. Thank you very much for having me, Randy.
So give us a little brief intro to yourself. How did your career lead you to your current role with Georgian Bay General Hospital?
Yes, I've been in healthcare probably about 20 years now. So 17 of those were way up north, about 8 hours north of here, up in Chapleau. And I was ready for a change of a larger center. This is a larger center compared to where I was. And just the being closer to urban centers was a big attraction. And a beautiful community like this was an easy decision to come to.
Great. We also have with us Bill Gordon today, Midland Town Councillor for Ward 2. Nice to see you, Bill.
Thanks for having me and inviting me.
So as one of the new members of council this term, what led you to throwing in your hat in the ring to get into the world of municipal politics?
Well, the short answer is really that I couldn't do it for the 24 years with the Midland Police Service. We weren't allowed to. So when the service disbanded, it was a perfect opportunity to continue my community service and have a voice and represent the fine people of Ward 2 and arguably the entire town of Midland around the council table.
Great. And we also have Andy Campbell with us today. Andy is the Executive Director of Environment and Infrastructure for the town of Midland. Andy, welcome to the show. Nice to see you.
Yeah, thank you very much.
So you've worked in private and public sectors during your career. Was there anything specific that led you to your role currently with the town of Midland?
Well, I've been a resident of Simcoe County for 20 years and working for larger municipalities across the province, the private sector. And in Midland, it was an opportunity to work with a small community, look at how we can bring some of the ideas from the bigger municipalities to the smaller ones and really drive change and move Midland to be ready for growth, be ready for the future.
Great. Well, thanks for playing our round of speed dating there, folks. Let's get into the first segment, though, COVID-19 in North Simcoe. So, Gail, I'll start with you, but everyone, I'd like your views on it as well. But Gail, in your view, from your perspective, what's the status of COVID-19 in North Simcoe currently?
From my perspective, what we've seen here anecdotally is that we've been really lucky. We haven't had a major surge like some of our neighbors have. So we're really happy about that. And we hope that that can continue as the restrictions lift and we see more seasonal residents move into our area.
Andy, Bill, what are your thoughts on the current situation from your views?
Go ahead, Andy.
I look after water, wastewater, and roads, and those are essential services. And our staff have been great, working together, making sure they're following all the new protocols around hygiene and personal protective equipment, and making sure they can still provide safe, quality water to our residents and look after our road network.
Bill, how about yourself? What are any views from the view of council?
Yeah, COVID has been a real challenge. I think the most significant challenge for us, knowing that we have fully capable staff that are managing the day-to-day operations and keeping the lights on, despite the physical challenges, our biggest challenge is going to be paying for this in the end. This is a very expensive pandemic, globally, nationally, provincially, in the county, and it, of course, by trickle-down economics, it's going to cost a lot in the municipality. So we have a lot of challenges with our aging infrastructure and other costs that we have yet to even determine that are going to have to be paid for. And from a council perspective, I think that's going to be our number one role, aside from making sure that the staff are safe and that our service delivery continues, unabated as much as possible.
Now, so Gail, can you give us some idea of how staff at GBGH have had to adjust to this new normal we're currently living into? Like, have their day-to-day responsibilities changed much in any way?
Yeah, I think what the biggest change for our staff has been getting used to constant change. Everything's evolved, directives change constantly. So it's been staff getting used to having to keep up to speed on the daily updates we send out with the new changes. How they practice providing healthcare is completely different today. I mean, universal precautions of having masking and gloves is all across the hospital now. Even the non-clinical staff walking around are masked because asymptomatic patients can be carriers and visitors. So we've had to change how we provide care in that respect and have a whole new thought process about how we provide services, having hot and cold zones to divide up the patients that are symptomatic. So staff are all having to be very creative with how we move forward from this and continue to offer services, but safely for the staff and the patients. So it's really been a 180 for them and how they provide care and getting used to changing on a dime as things evolve.
Yeah, very similar with town staff, I'm sure. So Andy, you can shed light on that. You oversee, a pretty large percentage of the town staff with the operations team, the water team. How have they had to adjust on the fly as we've progressed through this pandemic?
One of the key things we've had to do is break our teams into smaller teams, because our challenge and concern was, if I have my entire water and wastewater group in the lunchroom together and one of them gets sick, I'd have to quarantine the entire crew and we'd have no one left to provide safe water and wastewater. So we've broken into different teams. They're working in separate, isolated locations. And as a result, we're getting our mandatory work done. We're ensuring everything's safe. We're ensuring the employees are working safe. But they're not, because of their working apart, some of the synergies we get from working together aren't there. And also on the social side, we've had staff now that have been isolated working in a group of 2 for over 2 months. So, sometimes guys and girls like to work by themselves, but it drives other people stir crazy. So I think we're getting to the point where, although everyone is tired of being isolated in a work environment, it adds some extra stress.
Yeah, for sure. And of course, council's had to change their format. Bill, any views on the impact it's had on council?
Well, it was a struggle at first because we weren't really ready for electronic participation. That was something that was never allowed under our procedure policy. So despite it having come up a couple times and we couldn't get consensus to have it approved before the pandemic, everybody was united in approving it while the emergency is declared. So staff pulled it off. Electronic participation became a reality almost overnight. And now, as of the last council meeting, we've even got a way to continue our community involvement, so deputations and public meetings can continue over the electronic platform. Personally, I'd like to see this not, self-destruct at the end of the pandemic. I think this should be an option moving forward. But for now, we're using it, and that's great. And we can deal with whether it continues on in perpetuity after. That's another discussion for another day.
Right. Now, early on in the pandemic, especially, a lot of the talk from the Premier's office was trying to flatten the curve so that we didn't overwhelm the hospitals and the healthcare system. From Georgian Bay General Hospital's perspective, Gail, have we ever come close at this point to maxing out the capacity for ICU patients or ventilator patients?
Not as of yet. I mean, we've had part of our planning was to increase capacity. So we undertook that like all hospitals did. And part of that was to be able to move from we have a maximum of 8 ICU beds possible for ventilation. And we had to increase that using a provincial stockpile if we reached a certain trigger point. So that would move us from being able to do 4 patients to all the way up to 8 ventilated patients and 13 total ICU beds. And we've had to pull that trigger once and increase, but they weren't due to COVID positive patients, just our usual ICU type patients, which we've seen a little bit of an increase in because at the beginning of this, people were actually delaying coming for care to the emergency departments, likely out of fear. So we saw people coming in, later than they should have. Strokes and heart attacks and appendicitis, all those things still happen, but our emerge volumes, like all hospitals, dropped to nearly half for several weeks. So we knew these acute patients would start coming in. So we have to pull the trigger once. We haven't had to for COVID, but there is a whole deployment plan and how that happens and how the province reallocates additional ventilators to hospitals.
Right. Now, over this past weekend, the Premier announced that basically anyone who wants to be tested for COVID-19 will not be turned away. So even if you have as few as one of the recognized symptoms, you'll be tested. So I'm assuming we should expect a sharp increase in testing around the corner?
It's not around the corner. It's already here. We definitely saw that immediately. Before that announcement, we were probably seeing on average around 20 patients a day for swabs in our assessment center. And that went up to over 100 a day in our assessment center. So we're monitoring that to see if it continues or maybe it's just a blip. And we are one of those clinics that's by appointment only. And the Premier said, you don't need an appointment. You can just walk right in. And that's not the way our clinic and some others that are operating. And mostly that's the reason for that is we'll still give you an appointment. You won't be refused. But it stops the patients from people from congregating together in large crowds, the lineup or wait times forever, and allows us to have some control. So if we see that it becomes a wait list, we'll increase that. One of the concerns we do have is, it's great to have universal testing. It can help spot asymptomatic patients, but the concerns, we don't want people to have a false sense of security about, not practicing social distancing and things like that. If they get a negative test result back, that's for a moment in time. That moment in time that you were swabbed, you were negative. So if they use it as a rationale to go out and start visiting and going to see their elderly parents and things like that and stop practicing social distancing, that's a concern about the universal testing, that just confirms a moment in time and you just still continue on with all the safe practices as public health is laid out.
Right. Now, I'm going to shift to the outlook provincially wide. Do you feel the efforts to flatten the curve are working? I mean, as of this morning, there's 383 new cases in Ontario, up from the number yesterday. The Simcoe-Muskoka District Health Unit numbers haven't been released for today, but as of yesterday, only 17 in Tay, Tiny, Penetanguishene, and Midland combined. Only 2 of those remain active, as far as we're aware. Bill, as one of the more active and accessible members of council, especially on social media, what have you seen from residents on how they've adjusted to the new normal we're living in?
Well, I think the residents of our community and our neighboring communities, one of which is depicted in my background, credits to Nate Lacroix for this beautiful, stunning picture behind me. I think everybody has responded very much like the rest of the province and the rest of the country. At first, it was a lot of fear, and people were searching for information and updates from anywhere they could. And then along came all the usual misinformation and disinformation that was reality in social media. And then started coming some gradual acceptance, and people started to figure out ways to deal with this and ways to work around some of the problems and the restrictions that they were now finding, and creative ways to try and stay in business if they could, and ways to support each other. And little chat groups started and video chat started, and people were supporting each other, and new support and caremongering groups were popping up. And you started to see the best of people really start to manifest itself, because trying to struggle with this pandemic and social isolation, and then encouraged isolation on top of that, can really impact people's mental health and their inability to go and continue seeking treatment from the professionals at the time, only compounded that. So I see online, and we've been hearing online, that people have been finding creative ways to support each other. Needless to say, there are still people falling through the cracks, and we can always do more. But by and large, I'm continually impressed by the resiliency of our community and how willing everyone is to jump in and lend a hand and help each other. And I'd like to believe that's happening elsewhere, but my focus is primarily on Midland and our community, and making sure that we put community first in everything we're doing. And so far, so good.
Right. Now, Gail, what's your perspective on the flattening of the curve? Do you see it working, or do you think we still have a lot of work left to do?
I do think it's working. I mean, we definitely see that here. We've had a very small comparative number of cases. We see people social distancing really well. I think the proof will be in how long people can maintain that. As the beautiful summer weather comes and the need to interact after a long period of time. And I think it's not about forbidding everything in the future. It's about how can we move forward, and the things that Bill outlined about finding new ways to do things, because we can't just stop doing everything. We have to find new ways to do it that is safe. So, and we're doing that in the hospital with the reopening of procedures and things like that. And our planning is that we need to go back to doing things again, but we need to do it differently so that's safe, so that we can keep the curve flattened and not worry about being overrun in the system.
Right. So we're all living this new mantra, wash your hands properly for 20 seconds, physical distancing, stay 2 meters apart, wear a mask in situations where you can't control that. What other advice, Gail, can you give the residents of North Simcoe to help stay the course during this time?
I think the other advice we want to give is that what we've been seeing here is that we want to encourage people to continue all those things, but we want to encourage them to not delay seeking health care. If you're concerned, we're concerned. If you feel, if you're concerned and you would have normally come to the Emerge for that, please come to the Emerge for that. We have protocols in place to keep you safe while you're here, to keep you safe, the staff safe. And most of the healthcare providers, your family physician or the family health team or Chigamik, they have a lot of virtual options. So you don't need to physically go there all the time. And if you do, they have precautions and protocols in place as well. So I think what we'd want to, what I definitely want to tell people is don't avoid your dealing with your own healthcare needs because that's important. And those things need to be addressed before you have no choice but to come here in an ambulance because you ignored your health. So during this time, you need to make yourself a priority. There's lots of resources for mental health issues. Reach out to those virtually as well, but take care of your everyday health. The normal health issues have not disappeared, and you need to pay attention to that and make sure you make yourself a priority.
Great. Well, unfortunately, that ends the time we have for this first segment. I'm sure we could talk about pandemic situation for quite a while, and I'm sure we will be. But unfortunately, we need to take a break. Gail, thank you very much for joining us today. We really appreciate your input and information, and stay safe, and hopefully we'll see you again on Engaging Midland.
Thanks so much
Gail,
for having me.
Please pass along our utmost thanks for all of the frontline workers at the hospital and that you interact with. They've been, I hate to use this term, it seems overused, but they really truly have been heroes. And that we really do appreciate all their work and the risk they've placed themselves under for us.
Thank you so much.
Great. Thanks, Bill, for adding that. And we'll be right back after this.
My daughter's birthday. She was blowing out the candles on her cake when we heard coming from the TV. So we stopped and listened, and it helped us get to safety. That's why when I think of my daughter's birthday, because now she gets to keep having them.
Situation.
Got your attention.
007 license to kill.
Is this really what you want? Living in the shadows? Always alone?
I don't stop to think about
it. The Matthews House Hospice Bucket List Lottery is now on. Time is running out. The grand prize draw is on July 1st. Tickets available online at mhh5050.ca and throughout South Simcoe. What's on your bucket list?
Welcome back to Engaging Midland. We're going to shift gears now and talk about the King Street Rejuvenation project. Phase 2 is currently underway. You've probably noticed this if you've been downtown recently. Andy, shed some light on this project. Why is it taking place? What's the purpose of it? And how long has this project been in the works leading up to this?
Well, this project has really been in the eye of some of the councillors for a number of years, going back even to 2010 and beyond. So it's been 3, maybe 4 council terms. The downtown master plan was completed in 2013, 2014, but taking community input, looked at how can we take downtown and refresh it? How can we deal with things? But on top of that, it's been the underground infrastructure, the water mains, the sewer mains. We have inadequate stormwater control down underground. So we've been looking at upgrading our utility pipes, all our communication wires from Rogers and Bell, and from our electrical servicing to the buildings. So it's over $12 million, the cost of this project. It's very significant. It's the largest project the town's actually undertaken. But at the end, we'll have a revitalized downtown core, revitalized infrastructure that's going to be there for another 100 years. So it's a really key project for us.
Now, $12 million, that's a lot of money. Bill, can you shed some light on how the town's funding this project?
Well, primarily we're dipping into the MPUC proceeds, which we put into reserves, and we're basically lending ourselves the money until we secure financing from the traditional financing avenue that municipalities use. So this allows us to go ahead without any, large grants from the province or other agencies. The fact that we weren't able to get much money and we started anyway has certainly come to my attention. And, the key, I guess, is if we couldn't qualify for the grants, that's another conversation. And we will have that in council to find out how we can better leverage grant money that we don't seem to be getting. But we just couldn't really wait much longer for this. The discharges of sewage overflowing into Georgian Bay when our system's overwhelmed, collapsing pipes, and all the work that has to be done underground that you just can't keep neglecting and putting off, necessitated this happening. And so we pulled the trigger, and of course, not knowing about the pandemic, and tried to get this done in a structured, methodical way that impacted our local downtown merchants and residents in the least amount possible. And the staff put together a heck of a plan, and the Love Your Laneways stepped up, and it's all happening right now, right in the middle of the pandemic.
Now, for those that aren't aware, Andy, what section of King Street is actually going to be dug up during this project?
Well, we're doing the renovations from Bayshore all the way up to Yonge Street. So that entire downtown core will have new servicing, new roads put in, new sidewalks, new trees, new street furniture. It's a complete package, wall to wall of the buildings, and then end to end.
Right. And what's the goal for this project to be complete? Are we looking at end of November, or is there some work that's planned to be done in 2021 still?
The underground work, the road work, the sidewalks, curbs, all of that should be done by the end of October. Some of the plant material, putting in the benches, some of the plant, the street furniture, that will be done next year. The contractor has until May, June next year to finish the project, but all the street will be open again for this winter, for traffic.
So the disruptive work will be complete, the beautification more next year.
That's correct.
Yeah. So with that being said, currently the street's closed up into Elizabeth Street right now. Do we have a transit detour identified yet? I know we've had some questions come in about that. And if we don't, do we have a timeline as to when we'll have that ready?
We're working with the contractors to speak around what is the schedule going to look like and getting that transit detour set up. So hopefully in the next week, we'll have that organized.
Great. Now, Bill made mention of this, and a lot of residents are well aware. This past Sunday, we had a heavy rain, and normally with a heavy rain or a fast thaw, we have sewer overflows. Basically, the combined sewers can't handle the amount of water coming in. It forces it to be dumped into the bay. Will this project solve this issue?
It solves part of it. that it's called I&I, inflow and infiltration into our pipes. On a normal day, we have around 9 megaliters of wastewater. During a huge rainstorm, we can have 20 to 23 megaliters. It's a huge amount increase. And our system being old, it's designed, and our operating license for the province allows us to divert that water into the harbor. And it happens automatically. There's nothing we can do to stop it. It's just the way the pipes are built. Over the last year, we took combined sewers out of Hugo Avenue on that stretch we did from east of Midland Avenue. There's about 23 road sections in town that still have these combined sewer pipes in it, and each one is millions of dollars to fix. It's going to be a number of years before we actually solve this problem. And our wastewater master plan that we're undertaking right now, hopefully we'll refine some of those costs for the long term.
Right. Now, it's never good when this happens. Obviously, we don't want to harm the environment, but to put it into some perspective, this overflow is only the third one we've had since the start of 2019. But that doesn't make it right. But clearly, Bill, I mean, weigh in on this. We're getting short on time here, but this clearly is a long-term fix that we're looking at, given the costs and the time it takes to complete this work, right?
Yeah, it's a multi-phase approach, and it's a staggering amount of money. It's more than we can just expect to raise by levies and on our ratepayers. We need to look for infrastructure grants and money from the government. I'm hoping it's still going to be there when the banks are emptied out from this pandemic. But the reality is we can't just ignore these things. We live in a settled service municipality. There's an expectation that when you flush the toilet, the stuff in it goes down and never comes back again and doesn't pop out of somebody else's basement drain. That's what we need to do. And there's also an expectation that doesn't dump into our gorgeous Georgian Bay, which is the main source of our drinking water. So, I mean, ultimately in the water table. So we have to do this. We need to come up with a plan. Their plan is being formulated. We hope to see that, I think this year, right, Mr. Campbell or Andy?
Yes, the master plan will be completed later this year.
And then we got to figure out how to pay for it. And
exactly.
And then we're going to come into an election. So it's not lost on us. This is a big deal. This is a lot of money, and these are priorities.
Yeah, for sure. I hate to cut everyone off. We're running out of time on this episode, but we will have the King Street project featured on a future one. I'd like to thank all of our guests again today, especially Gail Hunt from GBGH, who left after the first segment, as well as Bill Gordon and Andy Campbell. Remember, log on for more information about the King Street project and other projects on engagingmidland.ca. That's our show for today. Thanks for watching. Stay safe, and we'll see you next time on Engaging Midland.
Thanks a lot, everybody. Stay safe. Bye now.